Hi everyone, welcome to the short tutorial on prolactin secretion. So welcome to ilovepharmacology. So let's learn about prolactin secretion and its regulation in next coming 3 to 5 minutes. So let's learn the prolactin under these headings, that is prolactin secretion, what is the regulation through which prolactin gets secreted, on which organ the prolactin acts predominantly, and what is the response to the breastfeeding, and whether the prolactin secretion is different from milk let down reflex. So welcome to the prolactin secretion. So prolactin is the hormone which is secreted from the anterior pituitary hormone. To know the regulation, we need to understand the hypothalamo pituitary axis with respect to the target tissue. So prolactin, as you know, it is secreted from the anterior pituitary hormone through the stimulation of TRH, and dopamine will going to inhibit the prolactin secretion from anterior pituitary gland. So once the prolactin is secreted from the anterior pituitary, so it acts on the breast as well as other tissue. So it has got stimulatory action on the breast as well as other tissue. So on the breast, there is an intern stimulation of prolactin secretion subsequently through the suckling process during infant feeding stage. So basically what we need to understand is dopamine inhibits prolactin secretion, whereas antidopaminergic agents will stimulate prolactin secretion. That means today, those drugs which blocks dopamine, like antipsychotic drug which blocks D2 receptor, they can cause hyperprolactinemia. So coming to the regulation of prolactin secretion. So the major regulator of prolactin secretion is the dopamine, which stimulates the D2 receptor on the lactotropes, thereby it inhibits the prolactin secretion. So what are the factors increasing the secretion of prolactin levels? The sleep, the stress, hypoglycemia, exercise as well as sex steroids can increase the prolactin secretions. Coming to the organ on which prolactin acts predominantly and in whom. So prolactin acts predominantly in women, especially during pregnancy and postpartum period during breastfeeding. So during pregnancy, the maternal serum prolactin level starts increasing usually at 8 weeks of gestation, and it peaks to the highest level to 150 to 250 nanograms per ml at term, and their levels will going to decline during the post-pregnancy period. So it will decline unless the mother breastfeed to the infant is discontinued. So what happens means, so after the pregnancy, if mother doesn't breastfeeds the infant, the prolactin level will come down. So what happens to the response to the breastfeeding? So during suckling or any breast manipulation that can happen during the nursing mother, what happens is the signal gets transmitted from the breast to the hypothalamus via spinal cord. So this will lead to increase in the prolactin secretion. So did you know that there will be a rise of 10-fold rise in prolactin secretion within 30 minutes of stimulation? So usually it is more during 8 weeks of gestation, and also it peaks during term. So coming to the milk letdown reflex, usually milk letdown reflex is mediated by oxytocin release from the posterior pituitary gland. So did you know that high level of prolactin is present in amniotic fluid during the first trimester of pregnancy in humans? The reason being, the prolactin also gets synthesized and secreted through the decidual cells early in the pregnancy. So in this short tutorial, we learnt about how prolactin gets secreted, what are the regulators for prolactin secretion, so in whom prolactin acts predominantly, how the breastfeeding is responsible for prolactin release, and what is the milk letdown reflex. Thank you.